today we have with us Professor Stan Zlotkin of the University of Toronto and the Hospital for Sick Children in Toronto. Good morning, Professor
Good morning,
Zlotkin.
Susan. Good morning.
We are posing your questions on infant and child nutrition as well as nutritional anemias. So, I'll start with the first question.
Great.
What is the risk of malnutrition in hospitalized children in your country?
So, Susan, that's a great question, and it really depends on the type of hospital that we're talking about. I work in a tertiary quaternary care hospital, so this is a referral-based hospital. At our hospital, the Hospital for Sick Children, I would estimate, based on some research that we've recently done, that between 6 and 8% of children coming into our hospital are malnourished. If this were a community hospital, or perhaps a rural hospital, I would expect that the number of children with malnutrition would be much lower, in the range of probably 0 to 2%. But in my hospital, a tertiary quaternary care hospital, the number is quite high, between 6 and 8%.
Okay, thank you. In your view, is poor diet the most common cause of iron deficiency in childhood in Sweden? What other diagnoses should be considered? And often hemoglobin is unaffected, so do you always have to treat?
So really you've asked me 3 different questions. So if I'm talking about in Sweden, I would say that poor diet is the most likely cause of iron deficiency in childhood. The poor diet might in fact be associated with the early introduction of cow's milk. Cow's milk is not a very good source of iron, and in addition, for many children, if you feed them cow's milk at an early age, they can have a small amount of enteral blood loss into the stool. So in my view, poor diet would be the most common cause of iron deficiency in Sweden. If we were talking about countries in the developing world, I would say parasitic infections or malaria may also contribute. In Sweden, of course, that would not be the case. What other diagnoses should be considered? Well, I think in a young child, one would possibly consider celiac disease, which is relatively common, or gluten-induced enteropathy, and this can often cause iron deficiency in a young child, even in Sweden. So I would say that's probably after dieting, that would be the most common diagnosis. Of course, there are other more rare diagnoses that one could also consider. Often hemoglobin is unaffected. Do you always have to treat? So if I were measuring the hematologic status of the infant, I would look at hemoglobin and would also look at their iron status. If hemoglobin were normal and their iron status would be low, then I would consider dietary changes in order to improve the iron status of the child. I probably would not use medicinal iron. So in terms of treatment with medicinal iron, I would say the answer is no. If the iron level is low but hemoglobin is normal, I would try dietary manipulation to include more foods which are good sources of iron.
Thank you very much. The next question is, nutritional anemia is basically seen in poor countries. How common, though, is it in Canadian children?
Well, I'm pleased to say that it's relatively uncommon in Canadian children. I would say the number is probably around 3 or 4% of Canadian children would suffer from nutritionally related anemias if they were full-term normal weight children. In Canada, we have about 6 or 7% of children who are born premature or low weight for gestational age, and those children, they would suffer from an earlier anemia because they're born with low stores of iron. So I guess I wouldn't say that it's particularly a nutritional anemia, but more anemia associated with preterm birth. So in Canada, nutritional anemias are relatively uncommon. We have a large number of the immigrant populations from, for example, from South Asia. In that population, the numbers might be slightly higher than the typical 3% in Canada. They may be as high as 6 or 7 or even 8%. But in general, nutritional anemias are quite uncommon. The reason for that is that we have public health campaigns to recommend exclusive breastfeeding until 4 to 6 months of age. Or if an infant is not being breastfed, we recommend the use of iron-fortified formulas. And in both of those cases, an infant would be protected from the development of nutritional anemias.